I am Dr. Karibasappa, consultant physician, Cilnidipine with Telmisartan in uncontrolled hypertension, and also the role of Cilnidipine and Telmisartan combination in uncontrolled hypertension management and complication prevention. So hypertension is a common condition, but uncontrolled hypertension leads to severe life-threatening complications. According to the Global Burden of Disease study, the hypertension remains the leading risk factor for the cardiovascular mortality worldwide. So awareness and proper management are the key to preventing organ damage and improving patient outcomes. So hypertension is the number one risk factor for the cardiovascular disease. But by going to evidence-based complications, so we can see the left ventricular hypertrophy, coronary artery disease, heart failure, and even by seeing the pathophysiology in strokes, the ischemic stroke, the hypertension accounts for 54% of all strokes globally. So among ischemic stroke, the chronic hypertension damages small cerebral vessels, increasing the risk of thrombotic events. Even in hemorrhagic strokes, the elevated BP, high uncontrolled hypertension, weakens vessel walls and leading to rupture and causes the brain hemorrhage. In coming to renal things, we can see the kidney failure. So renal failure, the hypertension is the second leading cause of end-stage kidney diseases. Again, by from hypertension to renal. So in end-stage renal disease, the progressive nephron loss leads to dialysis dependence. Even the proteinuria, a marker of hypertensive renal damage that can predict cardiovascular risk. Coming to retinal changes, so the complication of hypertension, uncontrolled hypertension leads to hypertensive retinopathy, optic neuropathy. So in hypertensive retinopathy, there is a chronic high BP leads to vascular narrowing and also hemorrhages. In optic neuropathy, the reduced blood supply to the optic nerve can lead to vision loss. So coming to the combination of cilnidipine and telmisartan, this combination prevents the complications of hypertension. So cilnidipine provides the dual LN type blocking action, offering vasodilation, reduced sympathetic nerves activity, and suppression of neurohumoral mechanisms, ROS and SNS mechanisms, and comprehensive cardiovascular protection beyond the blood pressure regulation. So clinical benefits, the cardioprotection by reducing heart rate, infarct size, arrhythmias, and improving the left ventricular function. Here, the telmisartan reduces blood pressure by blocking AT1 receptors and leading to increased plasma renin and angiotensin II. It reduces the left ventricular mass and has beneficial hemodynamic effect in the high heart failure patients, and also improves the vascular compliance and reduces the arterial stiffness. This cilnidipine and telmisartan combination not only reduces the BP but also benefits the cardioprotective effects and attenuates the high BP and also high blood sugar levels and provides vasoprotective benefits. The combination therapy lowers the BP without causing reflex tachycardia and induces cardioprotective effects by increasing the expression of endothelial nitric oxide synthase and also provides vasoprotective benefits by inhibiting the DNA synthesis in cuff-induced vascular injury. According to recent survey results, the combination of this cilnidipine and telmisartan is the preferred treatment option for diabetic patients with hypertension in routine clinical practice. Even in routine, we are using this combination drugs, and it helps many patients in preventing the complications of hypertension. Even several studies indicated that the combination of telmisartan and cilnidipine, cilnidipine, significantly improves the BP control and lowers the urinary albumin secretion in hypertensive patients with diabetes. Compared to long-term effects of cilnidipine and telmisartan in hypertensive patients on markers of vascular complications, cilnidipine and telmisartan significantly reduced the clinic BP and 24 hours daytime and nighttime ambulatory systolic and diastolic BP over 12 months with similar reductions in both groups, both in diastolic and systolic BP is reduced with the combination of drugs. Telmisartan likely enhanced lipid metabolism and also cilnidipine reduced the aldosterone levels, highlighting their distinctive vascular benefits. So, lastly, I'll conclude with this prevention and management. So, early intervention with antihypertensive therapy is crucial for reducing the mortality. The telmisartan and cilnidipine, a dual benefit approach. So, the telmisartan provides the superior hypertension control and also it is a cardioprotective. Cilnidipine, a unique calcium channel blocker that reduces the sympathetic overactivity and protects against the proteinuria. So the combination therapy shows greater efficacy than monotherapy in reducing target organ damage. So I suggest in diabetic patients for uncontrolled hypertension, the combination of this cilnidipine and telmisartan is effective.